Hey everyone, Dr. Morse. We are going to talk a little bit about a clavicle fracture. So the clavicle or collarbone sits across here. We have one on each side. This is the most commonly injured bone in the body, predominantly for falling and trying to break your fall or landing hard in your shoulder. Traditionally, we know when we break it because it hurts like heck. Anytime you reach out in front or do anything with your arm on that side, you're going to be in a lot of pain. So there's a couple rules of thumb for breaking your collarbone. First of all, it is the most commonly injured bone, and it's actually one of the last to fuse, so it does take some time. The actual bone has a tendency to break in three different locations. You can have towards the shoulder tip, the shoulder blade in the back. You can have it in the middle, or you can have it closer to the chest, to the sternum. Now, the most common is the middle third, which is in the middle, and that is actually the best case scenario because those usually heal quite well without surgery, without needing much help. Things closer to the sternum are concerning because it can puncture the lung, it can puncture some other concerning blood vessels underneath the sternum, depending on how it angles. And then the other is up towards the shoulder, and depending on where that breaks, you can have some significant issues with your shoulder. So the most common is by far the middle third. These usually heal really well, oftentimes without surgery. People will just be in a sling for a couple weeks to a month. Maybe at about 6 weeks, it'll be maybe 80% healed or so. Some of the higher level athletes that are going to be throwing with the shoulder or going to be sustaining hits oftentimes want to reinforce this, and you can go in and put a metal plate with screws and kind of form a bridge with the bone underneath, and then they just put a bunch of screws in it. A lot of people eventually have to have that removed if it drives them crazy, but overall that's one way to reinforce it. If the fracture is on the medial aspect closer to the sternum, or on the lateral aspect closer to the shoulder, those almost always have to go to surgery because the bone A is not going to heal, and B, it's going to cause a lot of issues because of the angulation of the bone. So that gives you an idea of what a collarbone or clavicle fracture is and some of the ways to treat it. Often initial x-rays are sufficient. Sometimes we end up getting an MRI depending on the location, or even a CAT scan depending on what we're concerned about. But for the most part, very common injury, depending on the location, can be a big deal or not a big deal. Thanks for tuning in.